the problem of Catholic hospital having, like a huge share of all the states and refusing to provide not just abortion services, but, things like tubal ligations and vasectomies and, just routine health stuff. And now California's Attorney General Rob Bonta is suing. They nearly killed a woman. If I'm reading this thing right, according to the lawsuit, back in February, a woman named Anna Nuslock was rushed to Providence St. Joseph Hospital in Eureka, California, because her water broke only 15 weeks into her pregnancy. She was in pain. She was bleeding. Tests at the hospital confirmed that the twins she was carrying would not survive. That by itself is a tragic situation, but the hospital, this Catholic hospital, made it worse. According to her physician, quote, she was at increased risk of serious complications with every minute that passed, which meant that they had to get these fetuses out of her. They represented all kinds of problems, spiking blood pressure, infection, because her water had broken, and also to protect her ability to have children in the future. So the normal procedure would have been a medical abortion, just go in and take them out. But this was a Catholic hospital. So to quote from the lawsuit by the California Attorney General, quote, instead of providing the emergency medical care she needed, Providence Hospital offered her a bucket and towels. Let that sink in. You're hemorrhaging, potentially to death, and the emergency room physician says, here's a bucket and towels. She was sent away. The Catholic bishops who set the hospital policy said, well, there is another option. You could be airlifted to another hospital where they will actually take care of you. Problem is that would have cost her about $10,000 and her insurance wouldn't cover it. Option two, high-quality hospital with an ob-gyn section, in the state where she could have gotten care. It was a 5-hour drive. And her doctor said she would die within those 5 hours. She would not have been able to make it. So option three is the one to an emergency care facility, not a real hospital, but kind of one of these dock-in-the-box. But they, they had enough facilities, they had enough stuff there that they could deal with it. And that's what she did, along with it took her 20 minutes to get there, along with the bucket and the towels that were by then soaked in blood. The new doctor she met at the new hospital said she was, quote, actively hemorrhaging when she arrived. She never should have been in that situation. And as it turns out, there's a law in California. It's called California's Emergency Services Law that specifically protects patients. It bans patient dumping, and it says any facility with an ER has to treat people. So California's cracking down on a Catholic hospital. This is interesting.